Hello, I'm Peter Lackman from Great Ormond Street Hospital,
And I'm Jane Runnicles from the Royal Free in London.
and we're here to talk about strategic educational actions to aid healthcare professionals in recognising the deteriorating child. The first one is really to create a culture of improvement and patient safety. This is a commitment that leaders have to make, and it requires us at all levels to ask 5 key questions. We have to ask what has happened in the past, i.e., did any children deteriorate yesterday? We have to ask what's going to happen in the future. Do we expect or anticipate anyone deteriorating today? We have to ask, have we got systems in place to prevent deterioration? Are our systems reliable? Does everyone know what to do? And will everyone do the same thing? How do we integrate all of this learning into a system that allows the staff to provide the best care possible?
So our second action point is around knowing your team. And we all know that the hard part of change is managing the human side of change. So understanding how the team behaves and what drives them is crucial. Understanding their beliefs, values and assumptions. One way in which teams can learn to better work together is through regular simulation training. And this may be an important educational strategy to help the assessment and management of the deteriorating child.
But unfortunately, stimulation is just not enough. One needs action 3, which is focusing on the system. But what is the system? The system varies from the microsystem where the patients are and the team is, to the macro system, which is the entire organization. If one really wants to improve and improve on safety, one has to involve all levels of the system. What's more, there are many different teams and different microsystems working together that are essential in order to provide safety and high quality care. So the key is to understand the system in which you work, how that system interacts with other systems in the organization, and how they can all work together to improve care for patients, and in particular in this case, to detect deterioration early on.
Developing the microsystem is really crucial because that's where the change really occurs. So it's important to listen to the front line. It's the frontline clinicians who are best placed to identify some of the patient safety risks. It's important to engage them in quality improvement right from the start to help support their own ideas, but also engage them in the larger system change and larger scale change. One area is to empower them to develop situation awareness. So the use of safety huddles on a ward area so all members of the team are aware which patients at risk of deterioration is one example of an educational approach. Another is, of course, with simulation, where they can develop skills around situation awareness.
It all sounds easy, but it requires one big thing. That is learning how to standardize care so that everyone knows what to do and what to expect at any one time. That means one has to place the needs of the child first and not decide that every child is different. So, for example, if you look at sepsis, one has to have a standard approach to sepsis, like sepsis 6. One needs to know what to look for and do the same thing over and over again. That is to get reliability in care. And if one wants to communicate, it's very good to use a tool like SBAR, Situation Background Assessment Recommendation. That allows people to escalate so that mitigation can take place if necessary. And finally, you can standardize the ways you can detect deterioration. For example, introducing the early warning score, which can help you detect deterioration much earlier on.
Action 6 is knowing how to change. It's so important for all members of the staff to actually learn about change methodology. And the model for improvement and use of small tests of change is a model adapted by many healthcare settings. And the important point is continuous data measurement. It's crucially important to use run charts and statistical process control charts in order to measure data, but most importantly, to think about really innovative ways of engaging people in this data and displaying the data in a way that shows that it's data for improvement and not data for judgment.
And finally, we get to our last action point, which is possibly the foundation of all. The real experts about children are not us professionals, but the parents and the families that care for these children. In my experience, I've had 4 occasions in which I've had to speak to parents and state we watched their children deteriorate and eventually die. And their query is, why was I not listened to? If we had listened to the parental concerns, possibly these children would be alive. But we didn't. It's something that we have learned to our regret in retrospect. So listening to the concerns of parents and making sure that one takes that on board will only increase your situation awareness and will help you detect children deteriorate before they deteriorate. So that gets us to the final summary. There are 7 actions that we recommend as this educational strategy, and we think that all of them, if applied, can make a real difference to children. The first is to have leadership for safety. One has to lead at all times and make safety the number 1 priority in your organization and on your team. That means you need to know who your team is. What are the strengths, what are the weaknesses, and how can you continually improve them through exercises such as simulation? Then you have to focus on how the team interacts in the system with other systems. This means you have to understand the microsystem in which you work, the strengths, its purpose, and how you are going to act on deterioration. We need to standardize care by promoting reliability. This is something that is very essential in order to promote care, and in order to improve that, you have to know how to change. You have to use the model for improvement and PDSA cycles to do that. And finally, remember, the experts are really the parents.
So if you'd like to contact us, if you'd like to hear more and follow us on Twitter, here are our addresses. Peter's email is peter.lackman@gosh.nhs.uk and my email address is j.runnacles@nhs.net. Thank you very much.